So question number 1, a client undergoing endotracheal intubation, right, and receiving IV sedation and succinylcholine. Short after respiratory status has been stabilized, the client become flushed, profuse sweating, is called diaphoretic, and has a rigid jaw. Which medication should the nurse prepare to admit? So here we are going to discuss only 5 questions, but this 5 questions we learn 5 information for NCLEX board. And when you go through the chapter by chapter, different book, you will not learn it. But here it can help us to gather the information. In this question, like a patient undergo to the process of endotracheal intubation. So if a patient need to the invasive procedure like endotracheal intubation, we need to give them some anesthesia, right, for numbness or reduce the pain, reduce the sensation, so that surgeon can do the surgery. And so they gave IV sedative and succinylcholine, the anticholinergic. These two medication we use as a supporting or maintaining medication for anesthesia. Everything was good. After the respiratory status, everything settled down, but suddenly become flushed, means cutaneous blood supply increase. Also huge sweating, and also the rigid jaw. Definitely these 3 cardinal signs indicate something wrong with my patient, right? The rigid jaw. So which medication should the nurse prepare to admin? So here some side effect developed, and patient has a complaint like rigid jaw, sweating, and flaccid. Click the exhibit button for more information. So in NCLEX board, when you see something like this, you can see the button. If you click them, something will come like this. When you go through the data about the patient, we can find body temperature 105. Body temperature increase, but it is too much, 105, and it's called the malignant hyperthermia. Also, blood pressure is highly normal, 140/90. Heart rate 150 per minute. It is tachycardia. It is very natural. If your body increase the temperature or fever also lead to the increase the heart rate. Is called tachycardia. Respiratory rate is 28. It is increased as well, tachypnea. And saturation of oxygen is 98%. And this is so good, not a problem. But temperature is a problem. If your patient increase the temperature as a RN, if you do not try to reduce it, it is not professional, because our principles say not to harm, always do good, beneficial, non-maleficent. So anyway, go back to the point. I said high blood pressure, respiratory rate, or Heart rate is okay, highly normal, but temperature is too high. So our first responsibility to reduce the temperature. So like here the 4 option, epinephrine. Epinephrine do not have any rule to control the temperature, or patient already have a high heart rate. In that, if patient have a bradycardia or shock, we can try for epinephrine. Then say atropine. Atropine, do you have any rules here, atropine? Definitely no. Then glucagon. Your patient has no problem with diabetic, not hypoglycemia, not hypoglycemia. Then I have to give the glucagon. So only the another medication is called dantrolene. Dantrolene is it can treat the muscle spasm. It can also treat and prevent malignant hyperthermia. This is the information we learn from here. You could write a note. If any patient malignant hyperthermia occur, we can give them, or I can anticipate from the physician, will give dantrolene. And dantrolene is a dantrolene is a medication treat the muscle spasm, but it can also treat and prevent malignant hyperthermia. Let me read what they wrote. So here they're saying the malignant hyperthermia is very uncommon but life-threatening condition precipitated by general anesthesia. So general anesthesia can cause increased body temperature, right? Body temperature is malignantly increased. It is bad for your brain. They can cause damage to the brain. So another point they said, when we give them pre-anesthetic medication like succinyl-CoA, general anesthesia, they can chance to develop increased body temperature. Skeletal muscle become unable to control the calcium level, leading by a hypermetabolic state manifest by contracture and increase the temperature. So this is, we do not need basically, but this is the mechanism how body temperature increase and what the skeletal muscle, what do in case of medication, right? Let me read it. Skeletal muscle become unable to control calcium level. If calcium do not control, it will be involuntary movement. It is called seizure. Also lead to hypermetabolic state, what is manifest by contracture and increased body temperature. Early signs of malignant hyperthermia include tachypnea, tachycardia. So when your body temperature increases, your heart rate must increase. Your respiratory rate must be increased. So increased heart rate, increased body temperature, it helps to increase the heart rate, helps to increase the respiratory rate. And this is called tachypnea, tachycardia, and also rigid jaw. So this is a typical sign of malignant hypertension. And in the question already mentioning, patient has a tachycardia, tachypnea, and rigid jaw. As the condition progresses, the client develops a high fever, and muscle tissue is broken down, leading to hyperkalemia and cardiac dysrhythmia and myocardial urea. So you see, when muscle breakdown, extra protein come in circulation, and this protein, when passed through the kidney, they fall in stuck and lead to the acute kidney failure. And this is called rhabdomyolysis. So here this muscle tissue is broken down, which is lead to the hyperkalemia. And hypokalemia or hyperkalemia, both are bad for your heart. Both can lead to cardiac arrest. So malignant hypertension require emergent treatment with dantrolene. So dantrolene to reverse the progress of slowing the metabolism, succinylcholine should be disconnected. Succinylcholine is a anesthetic medication. Other interventions include applying cooling blanket to reduce the temperature and treat the high body level, high potassium level. So what next we could learn from here? So let me read it. Epinephrine is admitted for cardiac arrest, anaphylactic reaction, or severe asthma. For this clinical scenario, it is very early to give epinephrine. Atropine is an anticholinergic. It is used to treat bradycardia. It does not, but patient has a tachycardia. Here, the natural produce by the pancreas is glucagon is given intramuscularly or sub-Q or intravenous for severe hypoglycemia. This clinical scenario does not talk about any kind of hypoglycemia condition. Glucagon can be given to stimulate glycogenolysis in the liver or maybe raise the blood pressure. So what are the education tools from this question? So malignant hyperthermia is a life-threatening hypermetabolic condition, and also condition triggered by general anesthesia. Admin of the IV dantrolene show a metabolism and also is the priority of nursing action